history. I won't let no one come and take your place. Cause the love you give, it can't be replaced. See no one else to love me like you do. That's why I'm spend my life with you.
Actual blood draws. Okay, so you're gonna have people that'll say, hey, I'd rather you stick my finger, and then you're gonna have some that say, I'd rather you draw my blood. Because it's all in how they perceive the pain of the needle. But I always just let them know that this is not as bad as it used to be. Our lenses now have springs on them, so it doesn't go as deep as it used to go. We have full control over where we make our incision in, okay? And then I'll make it as quick and fast as possible, okay, to minimize the pain. Also, another thing to help take the pain away is making sure that you apply the right amount of pressure. We know that pressure with anything takes the pain away, just like when we apply the tourniquet on our patients, right? You'll notice that when somebody's getting ready to draw on us, the first thing we say is, your tourniquet's not tight enough, okay? Reason being, it's not because we want that vein to pop out, it's because most of the time when you apply that pressure from the vein, temporarily it gives you almost like a numbing agent, right? It doesn't make the stick feel as sharp as we would normally perceive it without the tourniquet being on, okay? So same thing with the finger, all right? So our capillaries contain capillary blood, okay? So that is a test question, okay? So when it asks, what does a dermal or capillary puncture contain? It contains capillary blood. Capillary blood is a mixture of arterial blood, venous blood, and a product that we call interstitial fluid. Okay? This fluid is located in between our cells. Okay? And so the way that our veins and our arteries are set up, okay, we know that that our veins are typically going to be deoxygenated, right? And our arteries are oxygenated blood, so that we highlighted blue and red when we look at it on charts, correct? Okay, so our arteries and our veins, we want to look at those as if they are tree trunks, okay? So we got the tree trunks in the ground. What comes after the tree trunks? If you're growing a tree, you got your trunks, and then come your branches, right? And so what happens with these is they branch out just like a tree. So your arteries turn into what we call arterioles, and your veins turn into what we call venules. Okay, so these are the branches that comes away from the actual tree trunks. So they're smaller, okay? And it's more that's gonna go throughout our body. Well, when we start to do that gas exchange that we talked about, when we talked about dropping off the deoxygenated blood, picking up the oxygenated blood, and then refiltering through the system, it does the exact same thing throughout our entire body, through our arteries and our veins once they begin to branch. So when it goes and it does this gas exchange from the arterioles and from the venules, which are the branches, we then get our twigs, okay? So our twigs are going to be the capillaries, because it's going to be a mixture of these two together, okay? So at this point, microscopically, your arteries and your venules are going to connect, okay? So we're going to have a combination of both types of blood when we're doing dermal and capillary sticks. Make sense? Okay? So our veins and our arteries are the tree branches. Our venules, okay, which are the smaller branches that go throughout our body, okay? They're going to then combine together with our capillaries, which is going to be a combination of the both. And then it picks up the interstitial fluid, because the interstitial fluid is in between each one of our cells. So this is also why it's very important that when you puncture your patient, okay, you always, always, always wipe away the first drop of blood. That is a test question. Okay? We want to wipe away that first drop of blood because A, it contains your interstitial fluid. Okay? B, we want to make sure that we wipe off the alcohol that could possibly contaminate the specimen. Because we always have to make sure that we are cleaning the patient's puncture site with the 70% isopropyl alcohol, right? So we're wiping away the interstitial fluid and the remaining alcohol. All right? And then we can begin our collection. All right? So what two fingers?
The middle finger and the ring finger.
Okay. Which direction is our cut gonna go?
Perpendicular.
Perpendicular to the fingerprint, right? Okay.
Excuse me.
Yes.
What is perpendicular?
I'm gonna show you with the lancet. Okay. So we're gonna go across the fingerprint, but I have to demonstrate it. Okay. And our capillary blood, okay, which is the dermal puncture, is made up of what?
Venous and arterial fluid and interstitial
Fluid.
Interstitial fluid, okay? So that's the fluid that is in between our cells. And so before we collect our dermal and capillary puncture specimens, we have to always
Wipe away the first drop.
wipe away the first drop of blood. Everybody got it?
Yes.
Okay. All right, so I just need a volunteer.
I'm me. Cause I don't wanna get stuck by nobody.
Neonates. Okay, so you'll still, like if you work in a hospital, you're definitely gonna be drawing regular blood on them. But most oftentimes, if we can preserve them, if they're gonna be in there for a long period of time, then we'll go to the heel sticks. Okay, so you'll be in there doing butterflies on the little bitties. Okay. All right. Let's pair this off and pair it back on. Okay. So first thing I want to do is I am going to ask my patient if I can use their middle finger on their non-dominant hand. Why do you think we ask for the non-dominant hand?
Because this is the one we don't use as much.
Because that is the one that you don't use as much. A lot of people are on keyboards, cell phones, all that. Okay. As I'm talking to my patient, you will notice that I am taking her hand and I'm kind of embracing it myself because I'm trying to get it warm, making sure that the blood flows sufficiently. First her hands was purple, now they're pink, right? So I can see that her circulation is sufficient now, okay? All right, so Lucini, have you ever had a finger stick done before? Okay, all right, so we're gonna use your middle finger, okay? I'll try to make it as quick and painless as possible. All right, so I'm just kind of checking your blood flow. As I'm doing this, okay, I'm also letting her know that I'm getting ready to clean her finger off, okay? I'm gonna get you clean with an alcohol wipe.
So we don't have to do concentric circles? Okay.
All right, you always want to allow it to dry, okay? In the event that you're ready to go ahead and do the stick, you can use a sterile gauze to actually wipe the site dry, okay? When it comes to the lancet, okay, you guys have a trigger here, okay? Then you have your arrow. Your arrow is where it's going to show you where your needle is angled, okay? So remember I said that we're gonna do perpendicular cuts. Okay, we're gonna twist that off. That's trash, okay? I'm going to grab her finger at the bend, at the distal phalanx. So that is the bend of her finger. And I'm just gonna kind of squeeze. And you see how it brings the blood down to the tip of her finger? Mm-hmm. Okay? I'm going to take my lancet. My arrow is going to be facing me, but it's gonna also be going across her fingerprint, okay? So this is perpendicular, going across the fingerprint. It's not on the side, okay? It's not directly on the top of the fingerprint. Okay, but it's right here going perpendicular. Everybody see this placement? Mm-hmm. Okay, you're gonna apply gentle pressure and you're gonna count to 3 and then you're gonna hit the trigger, okay? On a count of 3, 1, 2, 3. Okay?
No, just the after effect. You can feel the sting after.
Okay, so my needle automatically retracted, but that still goes into the sharps. Again, we always do what with the first drop of blood?
Wipe it away.
Okay, so I'm wipe away this first drop of blood. It is very important that you apply consistent pressure, okay? So I'm going to get my machine ready. Okay, so we're going to do her glucose first. So I'm going to take the machine and I'm just going to tap it up against that drop of blood. Okay. Then I'm going to take my pipette. Okay. Holding it perpendicular, making sure you don't touch the patient's skin. You're going to allow the pipette to just suck it up. You don't want to squeeze the bowl. Okay. If you keep consistent pressure on there, it'll also keep from you getting air bubbles. Okay. Filled it up to the black mark. Now I'm going to apply pressure for just a second, and I'm going to squeeze the blood directly into the machine and get rid of my pipette. Okay. Now, we're going to say that the doctor wants us to collect a lavender tube on the patient. Okay, you guys see this lip? You want to get blood drops, okay? To go into the tube in order for it to work. So we're going to form complete blood drops. Again, we're wiping in between each one to prevent from making a mess. And we want to make sure that we get enough blood to get to the fill line, okay? You don't want to milk your patient's finger because you can contaminate the specimen by breaking down the red blood cells. Okay, so we're just going to do consistent flow.
How far you to fill this up?
So this one, the minimum fill line is 250. The maximum is 500. Okay, the goal is to get as much as you can, because we don't know how many tests the doctor is going to end up running off of this blood. Okay? In the event that you can't fill it up, as long as you get to the minimum fill line, you should be just fine. You're going to label this specimen just like you would your regular blood tubes. All right. I'm assuming we're going to go ahead and stop there. Okay. I'm going to grab my second gauze. I'm going to have her apply pressure. Okay. I'm going to put my top on. Okay, I'm going to invert my tube. Okay, do I have 250 in there?
Yes.
Okay, so I have the minimum fill line, so we can actually send this specimen in. Okay, my gloves are contaminated. Okay, so I'm going to switch them out. Let's make me some small gloves.
So we can only do it on the middle and ring finger, right?
Middle and ring finger of the hand. And then we'll talk about the feet tomorrow. Okay, so I got my results from her cholesterol and her glucose. So I will record that. Okay, I always make my patients walk away with a Band-Aid. Why?
So that there won't be no spill.
Yeah, it could be, yep, or after effects. So most oftentimes when that muscle heats up, when those muscles start to heat up, it thins our blood and gives us good circulation. So even though it's just a small poke, okay, we're still at risk of her bleeding all over the place. All right, so I'm going to apply my bandage. All right. I'm going to label my tube. Same information, last name, first name, date of birth, today's date, time collected, your initials. Okay, that's ready. My results, I'm going to write it down on my tracking sheet. I'm going to write it down on my patient summary sheet that goes with my patient. And then I always instruct them whenever we collect specimens to send off to the lab, I tell them results will be in within 7 to 10 business days. That way, obviously they're gonna come in earlier, but the patient is going to think you're the hero when they come in next day or the day after, right? Okay, then I'm going to dispose of my strips. Okay. Straps contain or bio. Okay. Whatever you have available. Okay, and then we're done with the procedure.
It wasn't too bad at all.
Not bad.
I won't let no one come and take your place. Cause the love you give, you can't be replaced.